Hello, my name is Dr. Jamie Bhamra. I'm an ophthalmologist and cornea specialist at Vector Eye Center. What does that mean, cornea specialist? Let me give you a little bit of background because this is a common question. At Vector Eye Center, we have a group of doctors. We have ophthalmologists, we have myself, who's a cornea specialist, and then we have optometrists. So a simple way to think about things is ophthalmologists do eye surgery, and optometrists are really specialists in glasses and contact lenses. Well, albeit that may be true, it's not completely explaining the whole picture. So optometrists undergo training. Usually you have a degree that you do first, and then you go to optometry school, and then you can do an optional residency where you get extra training in a certain part of the eye. Ophthalmologists, on the other hand, do undergraduate training too, so they get a degree, and then we go to medical school. So we become medical doctors, and then you do a residency. A residency is usually 5 years, and then there's an optional fellowship. So I did all of that training, but then I did a fellowship. And this fellowship is specific training. So I did training in cornea, external disease, uveitis, and refractive surgery. I know, sounds like a lot. It did take a number of years, but it gives you a great deal of skills and a different perspective on medicine. So when you come to Vector Eye Center, you'll see a number of different doctors, and you get a different perspective, which is why I think coming to see us is so unique, because all of us work together and we can give you that global perspective on your eye care. And so what does a cornea specialist do? So in my training, because you're a medical doctor and you go through fellowship, I focus a lot on systemic disease of the eye. So I'm just not doing surgery all day and operating on eyeballs. I do that, but I also have a vast part of my practice, which is medical. So I will see complex ocular surface, so the surface of your eye, disease. It can be from your body, so if you have an autoimmune disease, if you have some sort of systemic entity that's bugging you, or if it's just an external problem, such as dry eye. But there's many different manifestations of dry eye that can be a combination of both. And so we can give you that perspective, and I, due to the training that I have, can give you just a little bit more of a unique perspective based on that. And yes, I do operate on eyeballs a lot. And what would that mean? Well, I do cornea transplantation. So the front of the eye is a clear window, right? You got the clear window of the eye, you got the colored part of the eye, and then the back of the eye. This clear window can be hurt in trauma, autoimmune disease, from birth. You can have different shapes where the cornea is supposed to be shaped like this, but it changes over time, like keratoconus or pellucid marginal degeneration. So all of these different types of presentations may end up having different types of cornea transplants. Now, cornea transplants is when you change a part of the front of the cornea with someone who's passed away. Now, there's really 5 types of cornea transplants. We'll take different layers of the cornea, and I will substitute them for the cornea that you had in your eye if you need that surgery. But then also we'll do cataract surgery, which is a surgery with a lens within your eye, ages over time, and we remove that. If there's any diseases like cancers of the ocular surface, so not just the clear part of the eye, but you can see the white part of the eye and the clear part on top of that. So that's a lot of the things that a cornea specialist will do, plus a lot of the complex medicine that affects the front of the eye. Now, further into the surgery mode, I also do refractive surgery. So refractive surgery is where you come in, you're like, look, man, I don't want to wear glasses anymore. And so what can we do to help you with that? Well, there's 4 major types of surgery. One would be the laser surgeries, where the surface of the eye is kind of carved out or changed. You've probably heard of LASIK, PRK, or SMILE. So those are the types of laser eye surgery. And we can offer that to you at Vector Eye Center. There's also refractive lens exchange. So the lens that's within your eye over time will naturally age to a cataract. But sometimes before that happens, you can take it out when it's clear. And I can substitute with a lens. And these lenses are so powerful nowadays, they can give you vision for distance in computer, or distance computer and near. And then there's other types of lens technologies where you can actually adjust the lens after you even put it in. So Vector Eye Center is kind of up to date, and we're keen on technology to move forward in this. Another type of refractive surgery is ICL. So there's a clear part of your eye. You don't qualify for laser in this situation. You have the colored part of your eye, and then I just slip another lens into your eye. Anytime you perform a surgery to the eye, whether it be cataract surgery, refractive lens exchange, ICL, or laser eye surgery, or a slew of the other surgeries. The surgery itself will cause the eye to become drier because we cut nerves into the eye, but also because we live in Alberta. So dry eye is a really important with any type of ocular surgery that you perform. At Vector Eye Center, we offer all of the modalities for dry eye treatment. Some of the featured treatments are the applied lid thermal treatments. So we do intense pulse light, or IPL. We do radio frequency, or RF. We'll offer LipiFlow or MiBaFlow, and then we have a slew of other treatments, depending if you have mild, moderate, or severe dry eye. One of the big things that we look at in 2023 is how consistent and how many and how functional are the oil glands that live in your eyelids. So you have about 70 oil glands, probably about 40 on average up top and 30 down below. Not everybody is suitable for these treatments. It also depends on your skin type. For example, my skin type being darker does not qualify for some of the treatments that we offer. So having a perspective where we do a comprehensive workup is beneficial, and also knowing that we're only going to offer you a treatment if we think you qualify and if it's actually going to be helpful. And so dry eye itself can just be from an outside-in problem, so ocular surface stuff, where you're staring a lot. You don't blink as much because of screens, books, or driving. But they can also be from autoimmune or systemic problems, where like diabetes or Sjogren's disease or autoimmune diseases affect you. So really looking at your general health in totality is important in a lot of eye diseases. So your general health can affect your general eye health. So it is very important to see an ophthalmologist or an optometrist really annually to ensure that you're having no problems with your eyes. Thank you very much for reviewing this video. I hope you find it helpful.